Preventing kidney disease begins with understanding that it often develops silently, without any obvious symptoms at first. Many people may be walking around with impaired kidney function and have no idea, which is why regular checkups with your family doctor are so important. During those checkups, simple blood and urine tests can reveal early signs of kidney trouble. One key measurement is creatinine, a waste product that comes from normal muscle activity. In healthy individuals, creatinine is filtered out of the blood by the kidneys. But when kidney function drops, creatinine levels in the bloodstream begin to rise. When your doctor measures your creatinine level, it's used to calculate something called your glomerular filtration rate, or GFR. This number is based on your age, sex, and creatinine level and tells how efficiently your kidneys are filtering blood. A normal GFR usually falls between 70 and 100, although it tends to decline naturally with age. Knowing your GFR is one of the best ways to monitor your kidney health. Alongside the blood test, your doctor may also check for protein in your urine. Healthy kidneys prevent protein from leaking into urine. If protein is found there, it could signal damage to the kidney's filtering units. These days, a test called the albumin to creatinine ratio, or ACR, can detect this with just one urine sample. The more protein you're leaking, the greater your risk for kidney disease progression. Protein in the urine is not only a red flag for kidney damage, but it also increases the risk for cardiovascular problems. That's because kidneys are full of blood vessels, and they receive about 20% of your heart's blood flow. Damage to the kidneys often reflects broader vascular issues. These organs filter about 200 liters of fluid every day, making them essential to maintaining the balance of water, salt, and waste in your body. Unfortunately, early kidney disease doesn't usually cause noticeable symptoms. When symptoms do occur, they might be subtle, like fatigue, puffiness in the ankles, shortness of breath from fluid in the lungs, or loss of appetite, nausea, or itching caused by toxin buildup. These symptoms typically show up only when kidney function has significantly declined. Some people might notice changes in how often they urinate, particularly waking frequently at night to pee. In men, this could also be linked to an enlarged prostate, which can cause urinary blockage and stress the kidneys. But in many cases, people feel fine and have no idea anything is wrong, which is why routine lab testing is so important. So how do you prevent kidney disease? It starts with controlling the common causes. Diabetes is the #1 cause of kidney failure, particularly type 2 diabetes, which is increasingly common. High blood pressure is another major contributor, along with vascular diseases that affect either large or small kidney arteries. Chronic inflammation in the kidneys, repeated infections, obstructions, and inherited conditions like polycystic kidney disease also play a role. While you can't always control your genes, you can manage your lifestyle. A heart-healthy diet, regular exercise, avoiding smoking, and minimizing alcohol are foundational. One of the most discussed topics is sodium. Some argue salt isn't a big issue, but nephrologists stress that reducing salt helps avoid fluid buildup and high blood pressure. When your body holds onto salt, it also holds onto water, increasing strain on the heart and kidneys. That's why it's smart to cut back on salty foods, especially if you already have hypertension or kidney issues. In addition, steer clear of over-the-counter anti-inflammatory medications like ibuprofen when possible. These drugs can damage the kidneys over time, especially when taken frequently. Instead, use safer alternatives like acetaminophen for pain, and always check with your doctor before starting any new medication. Another essential step in prevention is taking your prescribed medications. If you have diabetes, high blood pressure, or high cholesterol, managing these conditions with both lifestyle changes and medication will protect your kidneys. In the past decade, we've seen a surge in new drugs that can slow or even halt kidney disease progression and reduce cardiovascular risk at the same time. If kidney damage is detected early, some causes can be reversed. For example, if you have a urinary blockage or are taking medications that stress the kidneys, stopping the problem early can lead to recovery. Some patients see improvement in their GFR and ACR after losing weight, changing their diet, and committing to regular physical activity. While full reversal isn't always possible, it's often possible to stabilize kidney function and prevent further damage. The earlier you act, the better your chances. Genetic factors can also play a role. If kidney disease runs in your family, especially polycystic kidney disease, it's a good idea to get screened. Doctors may use ultrasounds or CT scans to check for cysts. Genetic testing is expanding rapidly, but it's still mostly used when there's a known family history. Still, your genetic risk might not come from kidney-specific genes. It could stem from a predisposition to diabetes, high blood pressure, or vascular disease, conditions that all impact kidney health. Even if your parents had kidney problems, you can often avoid them through prevention. The bottom line is this: kidney disease can be detected early, managed effectively, and even prevented with the right choices. Stay on top of your health by getting regular lab tests to check your GFR and ACR. Eat healthy, stay active, maintain a healthy weight, and keep your blood pressure, cholesterol, and blood sugar under control. If your kidneys do fail, treatment options like dialysis or transplantation are available, offering hope and extended life. But remember, many people with kidney disease die not from kidney failure, but from heart disease. That's why the focus in nephrology has expanded to include protecting the heart as well. Therapies that reduce protein in urine and improve GFR also lower the chances of heart attacks and hospitalizations. This dual benefit is a major win for patients. You are not powerless in this fight. Whether you're trying to stay healthy or managing early-stage kidney issues, you have the ability to protect yourself. Being aware, staying informed, and working with your doctor can keep your kidneys strong for life. With the right steps, you're not just improving kidney health, you're boosting your overall well-being and longevity. Your kidneys work hard every day to keep you balanced. It's time you gave something back by taking care of them in return.